patient suffers from a worrying head injury.
You are going to hospital, I'm afraid.
Tests reveal a life-changing diagnosis for a collapsed walker.
If I hadn't gone up to Russell's Hall with my legs, I don't think they would have found out about the tumour or the lung cancer.
Doctors race to treat a young stab victim.
There you go, mate. Yeah.
Hello, matey.
Hiya.
Left side, lumbar region, wounds.
Every year, thousands of victims are hospitalised from knife attacks in the UK. And numbers are on the rise.
Generally, I think over the past few years, there's been a slow increase in the number of stabbings being reported and that we're responding to. Patient has isolated stab wound to the cardiac box anteriorly over.
Typically now we're seeing teenagers around school age being involved in knife crime.
How many times were you stabbed?
It does shock you to see that people are prepared to, commit a crime and take someone's life.
To increase the patient's chances of survival, a unique team of frontline staff are kept on standby.
The Merit team is a group of individuals who have specialist training, a trauma doctor together with a critical care practitioner who's had specialist training to work together as a team. We can deliver advanced surgical skills. We can deliver the advanced trauma care that a patient requires in that first hour after they're critically injured, which can make the difference between life and death.
No.
In 500 yards.
Yeah, the incident's been on channel 80. There's a vehicle on scene that was just passing by, I believe, and it looks as though it's pending, and there's also another DCA just pulling up.
Just ahead.
When I get some more info, I'll come back to you.
Exit at roundabout.
All right, Roger.
Breathing conscious, yeah. Potentially violent situation, location of offender unknown. Waiting for the police. So we've just been tasked to a male who allegedly has been assaulted. We believe that he has a head injury and he's been multiple times. It can be anything from a penknife all the way through to a machete. Those injuries can be quite minor, as I say, from a razor cut all the way through to fatal injuries involving multiple organs. One of the problems of injuries is that they are potentially fatal, and that can happen very quickly. So when a stabbing incident comes through, speed really is of the essence.
Not too far away, so it's showing 6 minutes, so I think that... There you go, look, there's the blue lights.
Yeah. Do you want to take it back?
Yep.
The Merit team have to find out how badly the patient is injured before getting him to hospital.
Hiya.
Left side, lumbar region, stab wound. Don't know what was used.
Yeah.
We've got sledgehammer that's been hit to left-hand side forehead.
Yep.
Passing as GCS 14 at this moment in time.
Okay.
Obs as you find them, attacking at 115.
Yep.
Normal blood pressure, SATs at 99%.
Okay.
They're just going down the cannulation route at the moment. Doesn't seem to be anything.
So my name's Ryan and this is Neil. All right, we've just come to assist the crew here just to make sure you're all right. Okay, you're normally fit and well?
So when we arrived, the patient was already being attended by a paramedic crew. They'd already made an initial assessment and they'd identified that he'd got a wound to his head. Dealing with head wounds is really challenging. It's difficult to know how serious that head wound is without the benefit of a scan.
All we're going to do is just ask a few more questions to what the crew already has, and just to make sure that, everything that's been done that needs to be done is being done, OK.
The worst case scenario is the bleeding compresses the brain, and given sufficient amount of time, that pressure will build to the point that eventually they will stop breathing and their heart may stop.
So whereabouts are your injuries, mate? Where have you been stabbed, do you think? Hey? Do Do you know, did you feel anything at all? Okay, you just felt your head, did you? Anything else?
Victims will often focus in on the area of their body that has been most severely injured, but they can have injuries elsewhere.
And were you knocked out, do you know?
So it's important that we examine the patient fully just to identify if there are any life-threatening wounds that the patient hasn't identified themselves.
Okay, as you lie there, mate, where's your pain?
My head.
Where else?
No.
Okay, can I get you to sit up? Is that okay? Sit forward, sit forward, sit forward, sit forward. Hold on, buddy. Okay, back's clear. Lift your arm up, matey. Okay, armpit on the other side, please. Okay, all clear, right. So whereabouts was it?
Before Merritt's arrival, the ambulance crew located a small stab wound in the patient's back.
Okay. Not got any pain in your buttocks or on the tops of your legs or anything? You've definitely got no problems around here? All right. Okay. Roll over to your left. Any pain here? Okay. Any pain there? All right, okay.
At the time, it was unclear what object had been used to stab the victim. For us, it's really important to try and identify the object, if possible, because that will give us an idea about the depth that has penetrated the body and the types of body organs that is involved.
Yeah, exactly.
So you've got that.
Yeah, that's all right, yeah. Yeah, that's fine, yeah.
Do you want them off again?
No, I'd leave the dots on, and then just because it gives us an idea about his heart rate and whether it's getting worse or not.
The key for me was to try and get to hospital as quickly as possible, to try and give him that greatest chance of survival.
Just going to put this fluid in your arm, mate. You're right. It's just in case you have any large amounts of bleeding. It's just going to help you.
Since I've become a merit doctor, I've certainly seen an increase in the number of...
He has a penetrating wound to the right lower lumbar.
As a doctor, we try and stay as objective as we can. I think personally, the younger the patient is, I think that's the harder to deal with.
The West Midlands is one of the most diverse areas in the UK. From inner-city Birmingham to the sprawling countryside of Staffordshire, hundreds of frontline staff are employed to cover its 5,000 square mile patch.
West Midlands is absolutely huge. Can be lonely working on the car if you let it be, but we just do so many miles that you know, we don't get a chance to be lonely, and we're just so busy. We go into a 71-year-old male, generally unwell, feeling very weak in his legs, and he feels like his lips are numb. So we just go and check him over, give the controller a quick update and see if we need a crew or not.
Numb lips can be a symptom of anything from an allergic reaction to a stroke.
Not too far away, we've shown about 4 minutes. Right, doors open, ready for us. Okay. Hello. My name's Catherine, what's yours? David. What's going on, David?
I don't know, I took the dogs for a walk, and when I was coming back, I felt very funny. My legs just went when we got to the gate.
Your legs buckled, did you fall onto the floor?
No, I was hanging on to the gate.
You just felt very weak?
Yeah.
Nothing wrong with your heart or anything?
No, well, the last thing I've had, the heart thing, they've said it's fine.
That's all clear.
I'm on to myself with me.
Right, OK, that's good. Can we take your arm out of this? Yeah? just nice and steady. Okie doke.
I'd taken the dogs out for a walk, and just when I was coming back, there's a gate up in the field, and my legs just seemed to go, and I had to stand there for about 5-6 minutes. I just didn't feel well at all. My head started spinning a bit, and my wife Liz phoned up, the ambulance, basically because she knows usually how fit I am, and I think it worried her an awful lot.
You feeling sick at all?
No.
No?
It's just, I had tingly around my lips.
Yes.
Under my tongue and at the end of my fingers.
David described his symptoms of feeling weak and having numbness in his fingers and his toes. That could be a sign of a TIA, a mini stroke, so that did cause a worry. David, can you raise this leg for me? Go on, push against me. OK. A bit shaky, aren't you? Can you do that one? Okie doke. All right. Give me a smile. Bob your tongue out at me. There's a reason for it. All right, shut your eyes. You put your tongue away now. Can you feel me touching your face? Yeah. And that side?
Yeah.
Does it feel the same both sides? Yeah. All right. David, open your eyes.
Can you do that again?
No. Can you open your eyes? This finger, put it on your nose. There. OK. And now just see if you can go away and come back to your nose. Right, put it back to your nose. And again, away, back to your nose. OK, that's fine. I sometimes ask a patient to put the finger on the nose and move it away and put it back, just to see if their aim is correct and right, and also shutting their eyes and stroking their face in different places, asking them if they can feel it. It's just to check their senses. If anybody's got a brain injury or there's anything going on like a bleed, sometimes these senses won't be precise, and it does give us a good indication of what may be going on. So far, so good. All right. Did David ask, well, Dad, should I say, did he ask you to call today? Ask you to call us? It was his decision, yeah, so he knew he felt poorly. Yeah. I'm talking about you at the moment.
I've wanted to bring him to hospital before when he's been really short of breath, gasping for breath.
Yeah.
Always refused.
Right.
But today he phoned me at work to say, come home, take me to hospital.
I've always been good in my legs because I was a postman. And you do a lot of walking with that, and obviously with doing the paper round on the cycling, your legs are going all the time, so I've never had a problem. So it was, a bit scary, to say the least.
Are you drinking plenty? Yeah? I mean, water, not alcohol.
I don't drink.
That's good, that's good. Okie doke.
But I don't smoke anymore.
No. How long have you been a non-smoker?
It's come up for a year.
Really? Well done.
10th to the 10th last year. So.
Have you felt better or worse?
Worse. I know it sounds...
It is doing you good though, but your body's got to get used to it. Yeah? Can you sit yourself right up now, David? Thank you. That's it. OK. What I want you to do... Hang on.
Oh, sorry.
Hang on. Fold your arms. Have a bit of a cough. Right, and sit yourself forward so I can... Good, so I can have a good listen. Nice, steady, deep breaths in and out. OK. Right, I'm just going to do the front now.
Hold on, I feel a bit...
So all them deep breaths in and out. Shall we have a rest? Yeah, I'm just going to have a little listen to the front now.
OK, do you want me to lift my shirt up?
No, that's fine.
I hope doing this my breath doesn't smell.
Pardon? I missed that. What did you say?
Oh, my breath doesn't smell.
No, you're all right. I'd like you to go to hospital and have some further tests.
You think so? OK.
Is that fine by you?
I'm not wasting your time.
You're not wasting nobody's time, all right? All his observations are absolutely fine. David's got a lot of ongoing problems at the moment. He's waiting for a CT scan, but he's almost collapsed on the way back from walking his dog, which is unusual, enough for him to ask for an ambulance because he's not that sort of fella. So, although everything's looking right here, A&E, maybe not exactly the right pathway, but it's, at the moment, we will take him in and just see if they pick anything else up.
Do with my head.
Well, we'll see, shall we?
I knew deep down I needed to go to hospital because nothing like this had ever happened before.
He didn't want to come out without his hat on. He says the neighbours never see him without his hat on. But he's looking a lot better now.
Lovely, thank you very much.
You're welcome. It's a case that there's something going on. His daughter's a physio. She's got her reservations that something's going on she doesn't know about. There's nothing hitting us in the face, but sometimes you just got to go with your gut instinct, and that's one of them.
Thousands of medical students across the UK are currently in training to become the next wave of emergency staff. Today, Keele medic Jonathan is joining volunteer Dr. Matt for a shift on the front line.
We've got John. John's a medical student who's attached to A&E at the moment. He's doing a year based in there, seeing what's going on and what it's like to work in A&E. And as part of that, he's coming out with our scheme, which is North Staffordshire Basics. It's a vital piece of education for the medical students to see what the world outside the hospital's like.
Yeah, looking forward to going out and working with the doctors and seeing what they get up to outside of the hospital.
Oh yeah, fingers crossed we'll have an interesting day, lots of stuff for you to see.
Yeah.
Now a call's just come through, reports of a patient who's unconscious or with a low conscious level. Not sure if it's a male or female, and we're about 4 minutes away, and there's an ambulance crew on its way as well. So.
A lot of calls vary. Sometimes we get a lot of detailed information regarding a case we're going to. Other times, such as this, information can be very sparse and we cannot have many details to go on. It's very difficult. I think scene safety has to be the first and foremost in your mind, especially if you've got somebody else out with you and you don't know what is on the other side of that door.
Hello, have you called ambulance?
Yes, bro.
So when we arrived, we saw the address was inside a block of flats. That instantly poses several problems. You're thinking, how much kit do I have to take and carry up these stairs? And also, how am I then going to get this patient out if he is critically unwell and we have to make a quick movement from there to the ambulance and onto the hospital?
Hello, are you all right? Okay, who's this fella?
His name's Wayne.
Okay, and how did you find him here?
How are you, man?
Wayne? Hello, you okay, matey? When did you last see him normal, without these injuries? Wayne, you just relax for us, mate.
Yeah, these injuries only come up this morning.
This morning, okay, and he was awake when he came up? Was he awake and talking to you?
Awake, he was all over the place.
And then he collapsed and that's when you rang the ambulance?
Well, he was sitting there and then that's it, bang. It's on the floor.
It was a difficult scene to interpret. Obviously, the patient was unable to tell us what had happened to him. His friend was quite vague in terms of he thinks he'd been there for a while and then collapsed, and he didn't really have any other history to give us as to what had happened to him at that point in time.
So he's come to this chap's flat this morning with these injuries, and then apparently had a decreasing level of consciousness since. So we've just got here, so if you guys are here, we'll flip him onto his back and see what's wrong. Wayne, we're just going to slide you and then turn you over, matey, all right?
It's always useful to have a background history of what's led up to him being unconscious, but you then just have to apply basic principles that you would to anybody
who you found on the floor, and that goes back to even basic first aid. Has he got a clear airway? Has he got a pulse? Are there any immediate interventions that we need to make at that point in time that could prevent him from deteriorating quicker?
Just open your eyes for me, Wayne. Okay, mate. You stick your tongue out for me. Good. Okie doke. I know you're freezing. I just want to have a quick look at your chest, make sure you're not hurt there, then I'll do you back up, all right? Have you got any pain in your legs here?
Yeah.
Which one? Both of them sore? Okay. And at the moment, his assessment in terms of his pulse, blood pressure and oxygen levels are fine.
You're cold, I know.
But he's got an obvious head injury above his right eye and on his left cheek. And he's also very cold. His temperature's only 34, suggests he might have been lying down for quite a while. So we need to get Wayne up to the hospital, possibly get some x-rays and a scan of his head and get him warmed up as well. So that's what we're just trying to do at the moment. Wayne, what's happened to you?
I'm hit.
You hit? Did you fall over?
Yeah.
No, what happened? Somebody hit you? You said that you got hit. When did that happen? Was that this morning? Yeah. All right.
His speech was very slurred, and it's difficult to know why that is at that point in time. Is it something to do with the wounds on the outside of his head? Has he suffered a severe head injury? Has this man had a fit or have some other medical problem? Is he possibly intoxicated? Worst case scenario for this is, has he suffered some damage directly to the brain? Is there bleeding, bruising or swelling around the brain from this possible fall or injury that he's sustained? And if that's the case, that can be life-threatening and he can deteriorate very quickly, which is why it was important for us to get him to hospital as quick as we could.
We need to take you up to the hospital. Okay, it's either you're going to come with us or the police are going to end up coming and they'll take you, so it's up to you. I can't leave you here like this.
It's a very fine line in terms of trying to make somebody go to hospital. In this particular case, there are several things that could have altered his decision-making, which is why it's important that we have to try and persuade him and reiterate the importance of him going to hospital.
Rain, your speech is slurred, you've got a head injury, you're cold, okay? Can't leave you here. We're going to sit you up and get you in a chair, all right? Might make you feel a bit better. Oh, there you go.
You spin you round and you can lean against the bed, mate, all right?
There you go. You are going to the hospital, I'm afraid.
It's all right.
Sometimes when a patient gets agitated towards ourselves, towards the ambulance crews, we do sometimes have to contact the police to have their assistance.
Wayne? Sit down, Wayne. Sit down there, then. Sit down for me, bud. Come on.
There you go. Well done, fella.
There was a sense of relief. It is always difficult to try and convince patients who have had injuries or had medical events happen why they need to go to hospital.
We have to act in the patient's best interests, and for him, with that head injury and his temperature, it was really important that he went up. That was an interesting job to see. So how did you find that as a job then, Jonathan?
As an interesting case. Yeah. Good experience.
Well, we've cleared with control, so we'll see what's going to come next for us. Yep. Okay, hopefully we'll keep the good jobs coming in for you.
This is because I let you off all the time.
71-year-old David Bremner called 999 after collapsing in the street, walking his dog.
I'd taken the dogs out for a walk, and just when I was coming back, my legs just seemed to go. I just didn't feel well at all. My head started spinning a bit, and so it was, yeah, a bit scary.
Kath carried out bedside tests to pinpoint the cause of his sudden turn.
Give me a good squeeze. Go on, push against me. Shut your eyes. You put your tongue away now.
But was unable to come to a clear diagnosis.
On this occasion, although all his obs are fine, gut feeling says send him in.
Extensive tests carried out in hospital revealed a sinister cause.
I had to go and have an X-ray, and it was actually through that they found out I had lung cancer. It was only about a week and a half after that they wanted me in for a PET scan, which gives a better view of, you know, your stomach and your lungs and that. And they said, we believe you've got a tumour on your diaphragm. It's life-changing, life-changing. Finding out you've got, you know, lung cancer and then a tumour. It's frightening because you hear about other people that have got tumours and, you know, they ain't got long to live, and you think, oh, is that going to happen to me? If I hadn't gone up to Russell's Hall with my legs, I don't think they would have found out about the tumour or the lung cancer.
Dr. Matt Rowley and medical student Jonathan are on their third call of the day.
Okay, so we've just got a call through now. We're on our way to a patient who's currently fitting. We don't know much more about it. We don't know if it's male or female.
So epileptic fits can be life-threatening. They can last anywhere from seconds to minutes into hours. The patient can stop breathing sometimes during a fit, which is why it's important we get there as quick as we can to treat them.
I think this looks like a suitable ambulance parking spot.
Staff at the care home found the patient having a fit in the reception area.
Hi.
Down the end there.
OK, thank you. Lovely chat. Hello. What's happened?
She's had epileptic fit.
Has she? Are you relatives or were you just here? Your husband? OK. Is she known epileptic?
She takes Tegretol.
OK.
It's been under control, but she's never had one this bad where she doesn't recognise where she is or who with anybody.
OK, what's her name?
Janet.
Janet, okay. Now, can I just have your arm, sweetheart? There you go. Okay.
Nicola was there, the manager, and I said, can you walk me down? I said, I don't feel too good. And then she just come sit down. And then I sat down and can't remember anything after that.
And how long has it been since she's had one of these episodes?
Yeah, a couple of months ago.
Okay.
About 6 weeks ago.
But before that, she hadn't had one for a long time.
No. Just going to go tight on your arm, Janet, OK.
When I got the phone call and I went down to her in the reception and she was lying in the chair, she was twitching while she was in the fit, and she'd been in it over 6-7 minutes, and it's never lasted that long before. And then when she come round and she didn't know me, she didn't know where she was, and all she was saying, she wanted to go home, you know, so that's when I knew that it was different from all the other fits that she'd had.
Do you remember me now? Janet? Do you remember me now?
I've seen you before.
You've seen me before, you're sort of remembering me a bit more now. Yeah, she doesn't know where she is, or who I am.
OK. And when she started going, what did she start doing? Was she shaking?
Shivering.
If a patient has a fit that's out of character to how they may normally suffer a seizure, it does make us worry. Is there something new that's happened within the brain? Is there something to do with the medication? Has some medication perhaps been missed? So there's lots of things to think about that we can't necessarily all address on scene.
And how long has she been on Tegretol for? Is it a long time?
Yeah.
No changes in dose recently, not missed any doses that we know of?
But she's been diagnosed with dementia.
Has she?
Yeah.
Is that why she's... Does she live here?
Yeah, that's why we moved here.
And you live here with her?
Yeah.
Or, yeah, okay.
18 months ago, my wife was diagnosed with the first stage of dementia. So it was hard, and it's a big shock, but she isn't too bad at the minute because she's at an early stage of dementia.
It was a shock, but I try to carry on.
So how bad's a dementia on a good day for her? Would she talk and know where she is?
Yeah, she's on the early stages.
Okay, she's just sometimes confused, but 99% of the time would be okay.
Yeah.
From the sounds of it, Janet's normally quite good. She can normally communicate, leads a relatively normal life and can hold a conversation. So we immediately know by looking at Janet that at the moment something's not quite right, as she's not talking to us at all.
Pop that little peg on that finger over here. What we're going to do is just slip your arm out of your... Is that a new cough that she's got? Always. She's heavy smoke. I think if we were in a position where these were happening all the time and it was normal with that degree of epilepsy, then we'd leave you here and get hubby to keep an eye. But being as they're not normal for you, better to get you popped up, a couple of blood tests, maybe a scan of the head and make sure everything's okay. Yeah, just confirming, have you got a crew running on this job to Oak Priory, please?
Boston, yeah, the crew should just be around with me now.
Lovely, thank you. All of her observations are stable. She's much more awake and with us now, but we're just going to pop up to A&E and get her checked over. Hi, you're right. Oh, this is Janet. So Janet's a known epileptic. Doesn't really tend to fit. She's on Tegretol. Got very early stages of dementia as well. Spoke to one of the carers today, said she doesn't feel very well, where she's then gone a bit shivery, shaky, gone very blank. She doesn't really know where she is. So this isn't a regular occurrence for her. So we thought probably up the road for assessment and go from there. OK. Lovely. Thank you very much. Are you happy? Great, thank you.
Because she's had epilepsy for a while, so I know what to expect. But this one is worrying because it's the first time, as I said, she's never recognised me or recognised where she's living. So we'll have to see what they say at the hospital.
Janet spent the night in hospital, where blood tests revealed the cause of her unusual fit.
She had
got a chest
infection. She got a chest infection, and she was being given antibiotics. The antibiotics had lowered the strength of the epilepsy treatment. That's what caused this epileptic fit.
3 weeks have passed, and Janet is again seizure-free.
I don't do the things as I used to do. I can't go where there's loads of people because I get myself all worked up and I'm frightened of having a fit.
We know the dementia's going to get worse. There's no two ways about that. We know what's coming, so we're prepared for it. That's why we're here. Everything's in place, so she's more confident in herself now because she knows everything's in place, and so she's quite happy.
I know I'm safe here, and I think this is a place for me now, and just try and lead a normal life as long as I can.
West Midlands Ambulance Service responds to hundreds of 999 calls from the elderly every day.
Ambulance service, how can I help?
If I can take the address...
Patients who can't reach a phone in an emergency can call for help using an alternative lifeline service.
Careline is a company that provides a lifeline as such. It's an emergency pendant service. People who live on their own, as long as they've got access to the pendant, which is either on their wrist or as an actual pendant over their neck, they can call it, they can press it, and they can get help. We're on the way to an 81-year-old female who's pulled her emergency cord, her Careline, basically they're just saying that she's got breathing difficulties and it's a possible panic attack. The fact that panic attacks have been mentioned, so whether or not it's a previous problem that they've had, we'll have a look. If it is a panic attack, we can hopefully sort that out here without the need for any of the resources being used or hospitals being needed. So fingers crossed, we'll have a look. Hello? Ambulance?
You need to check me over to see whether, to see what it is.
Right, what's been happening? Exactly what's happened there? So it's...
I've never had anything like this before.
Anything like what, my sweet?
It was about 4:15, you tell me. Yes.
About 4:15.
I didn't fall.
Valerie was reading a letter from her doctor when her anxiety worsened.
I needed my heart. I'm quite good at in the past.
So is it a sensation that you have in your chest? Is it like you can't get your breath, or is it a pressure or a pain, or...?
No, I wasn't in any pain.
OK, good.
I just was, I suppose, frightened.
OK, fair enough. It's a good way of describing it. Did you feel like your heart was racing, or...?
It did seem to be as if your heart was racing. You said, and you were trying to check your pulse.
How do you feel knowing yourself?
A stupid woman.
Why do you feel stupid?
If you take my blood pressure now, I bet it's probably, it'll soon be all right.
OK. Well, you pop your finger in there to start with. Anyone will do.
I bet you that at some stage my heart will be beating beautifully.
Doing all right at the minute. By the sounds of it, we'll just have a... And your blood pressure is absolutely spot on.
I knew you'd say that.
It's better than mine.
Anyway, have a look at me.
We'll have a listen to your chest.
I've still got one.
We'll just start at the front to start with. Give a cough for me. That'll do nicely. And just normal deep breaths for me. That's lovely. Keep doing that for me. The other side, darling. That's all right.
Yeah.
They're nice and clear.
It's always when you first wake, isn't it, Val, in the morning, and the fact that you'd had a nap.
You had a nap today?
A bad dream, and when you woke, that you were in such a state.
I don't go to sleep in the day.
I'm just wondering if that's just what's been happening before, or is this new today, or is this just you?
At the moment, I know that I've got a good brain, and it's not working properly. So in the end, one is tired, one is frightened of dementia. Okay?
Just going to do a few funny little tests if we can. I'm going to touch your forehead.
Yes.
Can you feel me touching that?
Yes.
And does it feel normal for you?
Yes.
Yep. OK, I'll touch your cheeks. Does that feel normal for you?
Yes.
Yep. And now under your chin. They all feel the same?
Yes.
Yeah, OK. When we just stroke the forehead, we work our way across the forehead and down the cheeks, and it's just make sure that all the sensation is the same. And that they feel, whatever they feel at the top is exactly the same at the bottom, and it's all normal. And it's all to do with the nerve that affects those parts of the skin, and that they're working properly. Puff your cheeks out. Screw your face up. Excellent. OK.
And what is this supposed to do?
What we're trying to rule out is possible causes. And what you try and work out when we go along, we try and work out, is it your heart? Well, your heart was fine, your blood pressure's fine. Your lungs were fine as well, because we had a listen and your oxygen levels were fine. So we kind of rule out everything that could be significant. And if it's going back to just anxiety, well, then that's what it is. That's what we know it is then, because we've proven that all the other tests are fine and all the body's functioning properly. That's why we do it.
So, in effect, that wouldn't... having dementia, you mean you would have a different set?
Not necessarily on those, but I'm going to ask you some questions in a second.
Oh, God.
Sorry. It's just some basic questions, Val, if we can. Do you know your date of birth? OK, who's the Queen?
Elizabeth.
OK, who's the Prime Minister?
Yes, we know him. David Cameron.
Sure?
Yes.
Positive?
Yes.
OK. If I tell you number 1, High Street, Hagley.
Number 1, High Street, Hagley.
Remember that. OK?
God, yes.
Do you have any family members?
Yes.
Who have you got? Who's your nearest, your next of kin?
Claire Beasley.
And who's she to you?
My daughter.
And what does she do for a job?
She's a very clever lady who drives, who has an accountancy.
Right, OK. And what address did I just ask you to remember?
1 High Street somewhere.
Where do you think? Can you remember?
1 High Street.
Can you remember the town I said?
1 High Street. 1 High Street, Hagley, no?
Spot on. There you go. Done. And she passed them all with flying colours. She did everything that I asked her to do, and I didn't even need... Some of them were quite hard to explain to some people who've got a fully functioning mind, never mind people that haven't, and she took it straight on board and did it there and then, so she was as bright as a button, bless her.
As soon as you come, you give me confidence. See?
I think the biggest thing is if you feel you're bad and you ask for help and someone comes, it's a relief off your shoulders, isn't it? Valerie, in terms of everything, everything's fine. And I think you've kind of calmed down a lot and you're a bit more talkative now and a bit more back to normal, yeah. So what I think we'll do is we'll stay at home now that you've kind of... I've made sure that I'm happy with everything. Val did the right thing, yeah. She obviously thought something wasn't right, and that's the key, really. If she thinks something's not right, she seeked advice and got it sorted. And I think that's the best advice for anyone, really. If you're unhappy, you're not sure, you call somebody out or you get help. Take care, Valerie. Look after yourself.
Pleasure.